Hello friends, I am Dr. Shrikant Kurhade. I am a laparoscopy and GI surgeon from Pune. Today I am going to talk about very important topic on hernia, that is complications because of the hernia. Generally, people think that hernia is very simple problem and it's okay to have it, and if we keep it like that only, nothing will happen. But it is absolutely wrong. What happens if we keep hernia untreated? There are complications. So generally 4 complications are commonly seen in case of hernia. First is irreducibility. In that, what happens when hernia sac is too big and the swelling is too big, what happens? Intestines remain outside of the body for longer period of time, and in between they form adhesions. So that what happens, whenever you lie down, they don't go inside the body and they remain outside as a bulge. It is called as irreducibility. Generally at that stage, some pain starts. Second complication is obstruction. So when hernia becomes irreducible and there are adhesions in between the intestine, there is some twisting and kink in the small intestine or large intestine, and that causes blockage of the intestine, so that intestinal contents will not move forward. This is called as obstruction. Obstruction patient will present with increased amount of pain. They will be bloating of the abdomen, they will be vomiting, and in that case we have to operate that patient as an emergency within 6 hours. If you don't do that, then our third complication appears, which is strangulation. Because of prolonged obstruction, the blood flow to the intestine is cut or it is decreased. That causes death or gangrene of the intestine. That is called as a strangulation. This is very life-threatening complications, and we have to operate that emergency basis. Only problem occurs in case of strangulated patient is sometimes we have to cut the intestine if it is not viable, and we have to stitch it. In that case, we cannot put mesh for reinforcement in hernia surgery. We have to just close the hernia defect. So in case of strangulated hernia cases, as we are not putting the mesh at its place, chances of recurrence and requiring further surgery is always there. So we should not wait till it complicates to that level, and we should get it operated as soon as possible. Fourth complication is, it is commonly seen in case of ventral hernia or incision hernia. When the big hernia sac is there, the contents are outside for longer period and patient continues to neglect the symptoms of hernia. What happens? There is a thinning of the skin over the hernia sac, and there may you find the ulceration. So fourth complication is ulceration. What are the implications of ulceration of the skin? Whenever there is ulceration of the skin during hernia repair, we have to excise that skin. So in that case, laparoscopy we cannot do, because anyway we are going to cut the skin. So we lose the advantage of laparoscopic surgery in case of whenever there are ulcerations on hernia sac. So we should not, in view of all these complications, we should not neglect the hernia. We should not take it lightly, and please visit your nearby surgeon for fixing your hernia. For further information on hernia, please subscribe our channel. Thank you.